My name is Corrina Keeling. I'm a graphic recorder, and this is an opportunity to see a little bit of a summary of some of the things that were highlighted during the course of the conference in a visual way. So the overview to the conference is that we're working towards a path towards a network, creating the vision for Canada, framing that our spirit of collaboration as Canadians really works in our favor when working towards building a network. Looking to Europe, how we can build on what's already happening there, identifying what is an ERN and the reasons why it's important, closing the gaps, closing the cultural silences, outlining that everything should be shared to produce better clinical outcomes. Looking at system integration, political, legal, referral, admin, funding, metrics, diagnostics, evaluation, data, sustainability. So every possible axis that's connected with the patient experiences needs to go through system integration. And how we measure that impact is through a common agenda, measurement, working together, communication, and ultimately a backbone organization that can actually handle the administration and outrolling that organization and that network. Making sure that we outline that this is a perpetually iterative dialogue. This is not a linear process. The guiding principle is always that it's patient-centered. So that's the frame that we'll be doing all of the work this weekend through. So starting out with some of the conversations of patients and their families and some of the language that came up being shock, devastation, helplessness, anger, grief, fatigue being a constant companion, feeling isolated and alone, and that is a common experience for people who experience rare diseases. Balancing the knowledge of the healthcare system, the research, and the medicine with the experiential knowledge of each rare disease's unique situation. The experience that when you intersect with the medical system and the healthcare system, that something you hear from yourself constantly is that I know my body better than anyone, and that something is wrong, having an innate knowledge that something's going on and not being taken seriously or being discredited because you're not a medical practitioner. Trying to figure out how to quantify innate and experiential knowledge, and again over here being patient-centered, making sure that we have the capacity to turn stories into evidence-based data to support the patient experience. We know that patients and families are always the best source for information. We don't have to start from scratch. So a good start would be stitching together smaller existing networks. We don't have to start everything from the ground up. We know that there's already opportunities across diverse regions for conversations and collaboration. And there is also an opportunity to use tech to make this knowledge more accessible to everyone on the healthcare team, not just to doctors and practitioners. So this frames a conversation around genomic research, moving from the period of 1980 through to 2020, where really most of the work was naming and identifying genes and genomes to kind of where we're at right now, the grand challenge from about 2000 to about 2040, where we move forward from just naming and identifying to understanding, analyzing, and also being able to translate the data into something meaningful. Building a network to be able to build relationships between clinical scientists who ID rare disease gene variants and basic scientists whose purpose is to analyze gene function, and that through the research that they're doing, it actually creates validation for the kind of work that's happening through high-impact publications. We get higher results for funding, higher results of access, higher recognition of these rare diseases and why they're so important to fund and support. Referencing that Canada can really be proud of our history and leadership of gene mapping. So the context of this grand challenge is that Canada has played a really important role leading up to now, and we can continue to be leaders. Understanding that the equation has to include patient experiences and stories in order to create this validation. Relationships with the patient is critical, obviously, first and foremost, for patient experience, but also because it improves the quality of research and treatment. When healthcare systems have readiness and research is scientifically recognized, and there is, through this process of validation with this network, when there is a rationale to produce commercially, that means that there's greater access to precision medication, not just for a few, but for everyone who needs it around the world. And along with access to this medication for people who don't have a diagnosis yet is the inquiry around understanding who is working on my disease, who is doing the research to my specific concern, my specific symptom list, my specific genome, and how can I track that progress. Another way we can track progress is to have an understanding of when, how, and why patients intersect with healthcare systems, so that we can follow their process not just when they're intersecting with the system, but along the whole pathway. And it's exciting to consider the opportunity to create notifications when there's innovation within the healthcare system, so that patients don't miss it and they can be included on the pathway to innovation with some of these treatments and some of this research. To succeed, we need a collaborative approach, so making sure that patients are always in the center and that the individuals and institutions who surround them, parents, doctors, pharmaceutical companies, advocacy groups, funders, folks who do research, scientists, understanding that they have a responsibility, everyone has a responsibility to inquire, what is my role in improving the patient experience? So not just the work that you do in your silo, but how does that intersect with what's happening for patients?